Universal health coverage for the country's poor families is a top priority for the Aquino administration. It has a record funding of 54 billion pesos for 2014. Health Secretary Enrique Ona said every poor family will receive the medical help they need to stay healthy. This report.
The Department of Health is finally getting the budget it needs to deliver the services needed by our people, especially the poor. For 2014, it's 84 billion pesos, up 50 from last year's outlay of 53 billion. Health insurance coverage for marginalized families will cover close to 15 million families, amounting to 34 billion pesos, more than double the amount of 2013 of 12.5 billion pesos. Because of this, out-of-pocket expenses for medical help, from medicines to doctors' fees and hospitalizations, are covered by PhilHealth. The PhilHealth contribution of 2,400 pesos is the amount subsidized by government for every poor family.
These are really the identified poor Filipinos who otherwise either are unable to get the care they have because they don't have the funds, or are not enrolled in PhilHealth because either for one reason or another they could not afford, or where the previous sharing of the local government was not there. And so therefore they are left uninsured, and that is what has been solved. Maybe I may add that that also is one of our problems today, is how to make sure that these additional more than 9 million families are made aware of their benefit.
Health coverage is now mandatory. The Aquino government is committed to full coverage of universal health care for all Filipinos by the end of the president's term in 2016. Coverage for poor families will mean that services will be provided for, and no one will be forced to pay fees they cannot afford. Another piece of good news: this early, the funding has been released early and available since the budget signed by the president is the document for providing the PhilHealth coverage.
Nung araw, ang lagi lang nating naiisip pupunta ka sa ospital, dapat hindi ka nga singilin. Subalit, lagi naman silang sinisingil. And in essence, that is understandable because those local government hospitals or even our national hospitals did not have the financial resources to absorb everything. But with PhilHealth coverage, ito nga yung mga ospital na ito, whether national government or yung local government hospitals, ibig sabihin yung ating district, provincial hospitals, will now be paid for by PhilHealth.
For the People's Television Network, this is Freddie Abando reporting.